Good afternoon. This is Nurse Eunice with Florida Training Academy, and I am back for another session. Today, we're going to cover 75 Practice CNA exam questions. And so we'll get started in about 10 seconds. Welcome, everybody. All right, so let's have fun and learn together. Whether you're a nursing assistant preparing for your certification or just looking to sharpen your skills, we've got you covered. We invite you to participate in our online practice test designed to help you gain confidence and master the key concepts needed to excel in patient care. Hey, Sham. Hey, Fatima. Be sure to take the test and challenge yourself. It's a great way to prepare for the real thing. Let us know your results and any questions in the comment area below. Happy learning. And then to support our channel, like, share, and subscribe. And yes, I'm coming to you before the hurricane because I'm not sure what's going to happen and when we're going to lose power. So keep us in your prayers as we keep you in our prayers. And Florida strong. We'll get through this. It's just going to be a little bit of delay before we post again. Let us get started. Question number one. What is the normal range for adult body temperature when taking orally? Is it 94 to 96.8 degrees Fahrenheit, 97.6 to 99.6 degrees Fahrenheit, 100 to 102 degrees Fahrenheit, or 103 up to 105 degrees Fahrenheit? Let's see what we have here. Hello, Miss Excellent. Hello, Felix. Triple dot. That's right. I'm glad you're here also. Karen, hello. Hi, Paul says B. Sham says B. Felix says B. Anna K. So looks like the B's have it. And of course, you're absolutely correct. So that's the normal oral temperature range for an adult, 97.6 to 99.6. Make sure you're keeping track. So at the end, you can post what your results were. So it looks like everybody got at least one question correct so far. Question number two. When given a bed bath, it is important to wash which part of the body first? Would that be the feet, the genitals, the face, or the arms? I'll give you about 3 seconds to enter your answers. We're doing a fast exam today because I need to get home. All right, so I'm so proud of you. Everyone chose C. You all are aware that we start from the cleanest area first and then work our way down to the dirtier area. So the face should be washed first to prevent spreading bacteria from other parts of the body to the face. Triple dot V was not an answer. I saw that. Question number three. Which of the following is the most important step when caring for a patient on fall precautions? Is it A, keeping the cold light within reach? B, encouraging the patient to walk unassisted? C, raising all side rails? Or D, using a walker for every patient? Laurentia, congratulations. You all know we're going to stop and give our babies applause. We're so proud of you. Congratulations on passing your examination. All right, so it looks like Fatima says A. We have A's, we have C's, we had more A's than C's. And so the correct response for this one is going to be A, keeping the cold light within reach. And we'll explain about those side rails. Remember that some of your patients are not in hospitals. You're going to have patients whenever you're taking your CNA exam. Think of anywhere a patient could be. So a patient could be in home care, they could be in a rehab center, they could be in a hospital setting. So not all of those different environments have beds with rails. So in order to keep someone safe, the side rails could be important, but making sure that cold light is within reach so that the person can request for assistance before they try to move. Aids in reducing the risk of falls more than just having the side rails up. So call bell first, and then you have your side rails as an additional option. Question number four. How should a CNA lift an object to avoid back strain? Yes, I am blessed by the best. Yes, not all rehab patients have beds that have side rails. So is it A, if you're helping someone, if you're lifting something, do you want to A, bend at the waist, B, keep knees straight, C, bend at the knees and keep your back straight, or D, lift with a quick jerking motion? D was painful to say, so I better not see you all lifting anything quick and jerking. That's not a good sign. Revealing the answer in 3, 2, and yes, if you chose bend at the knees, you understand that those leg muscles are the strongest muscles, and you want to utilize those instead of your back muscles when you're lifting heavy objects. I told you we're moving fast today. We have 75 questions. Question number 5. Which of the following statements about hand hygiene is correct? A, hand sanitizer is preferred over soap and water when hands are visibly dirty. B, you should wash your hands for at least 5 seconds. C, hands should be washed before and after patient contact. D, gloves replace the need for hand hygiene. Oh, Safira, Tasha, Sonise, hello, Vivian. You all did not hesitate to tell me that the answer was C. Yes, great job. So hands should be washed before and after patient contact to prevent the spread of infection. Remember that hand sanitizer does not kill all germs. And if you put on gloves and go around and touch everything and then touch the patient, well, you contaminate the patient. So gloves do not prevent the spread of germs either. A good caregiver with clean hands does. All right, question number 6. What is the most appropriate response when a patient begins choking but is still conscious? All right, so after you ask, hey, are you choking? Do you A, call 911 immediately? B, begin CPR? C, encourage the patient to cough forcefully? Or D, give them water to drink? Let's see. I know this one was a little bit tricky. I like this question because it made you think. And for everybody who chose C, so if that person can still cough, it's not a 100% obstruction. They have a mild obstruction. So if someone can cough, you want to encourage them to cough while they are still conscious. That's going to prevent you from having to perform the Heimlich maneuver and also calling that nurse in there. So if they can cough, ask them to cough, and that's going to hopefully help relieve their obstruction. Question number 7. What is the primary purpose of ROM, range of motion exercises? Is it A, to strengthen bones, B, improve respiratory function, C, prevent contractures and improve circulation, or D, increase appetite? Revealing the answer in 3, 2, and everybody got it correct. It is to prevent contractures and improve circulation. Remember, if you don't move it, you lose it. So ROM exercises help maintain joint flexibility and prevent contractures as well as improve circulation. So what is a contracture? Whenever you think about contractures, I want you to think about somebody whose joint is maybe fixated, maybe somebody who's had a stroke or some type of deformity because they weren't able to exercise the extremity. So a contracture is a fixed joint. Whenever you see somebody and their extremities are starting to turn inward, I need for you to help. You can start putting rolled washcloths in their hands to kind of open it up. You can ask the nurse to come in. Maybe physical therapy can give them a little brace or something for their wrist or their arm. And then don't forget to reposition them with pillows. Positioning matters if you're trying to prevent contractures in your patients. Question number 8. When is the appropriate time to take a patient's pulse? Is it A, immediately after exercise, B, after the patient drinks a cold beverage, C, when the patient is resting, D, after the patient eats a meal? The appropriate time to take a patient's pulse. Yes, 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 yes. You all are correct. The most appropriate time or accurate time is when the patient's at rest and they haven't performed a recent activity. So you don't want to get someone up to the bathroom and then take their vital signs. If it's an emergency, they have to go to the bathroom right away. What I encourage you to do is once you get them back seated in their chair or in the bed, you can go do other things. Give it about 10 minutes before you take their vital signs. Otherwise, their vital signs are going to be abnormally high because you took them after they exercise. For some older patients, walking to the bathroom is an exercise, especially if they have respiratory or cardiac issues. Question 9. Which of the following is an example of abuse? Is it A, giving a patient their medication on time, B, ignoring a patient's request for help with toileting, C, allowing a patient to refuse a meal, or D, talking with the patient about their health concerns? Which one is abuse? All right, we'll be revealing the answer in 3, 2, and yes, team. Very proud of you. It is B. Ignoring a request for help with toileting is a form of neglect and abuse. Remember, your patients have rights. Question number 10. What is the best way to communicate with a patient who is hearing impaired? Do you want to A, shout loudly, B, speak directly into their ear, C, speak slowly and clearly while facing the patient, or D, use gestures without speaking? What do you think? Revealing the answer in 3, 2, and I know you are proud of yourselves because I am so proud of you. You all are getting almost every answer correct. So if you chose C, speaking clearly while facing the patient allows the patient to read your lips and better understand what is being communicated. So that is how you would talk to someone who has a hearing impairment. Question number 11. Which of the following is a symptom of hypoglycemia? Is it A, high blood pressure, B, frequent urination, C, rapid weight loss, or D, confusion and shakiness? I see B's, I see a C, I see a D. We're kind of everywhere on this one. I see another C and I see a D. All right, so a symptom is something that you would be able to see. You wouldn't necessarily be able to see rapid weight gain. So it's not C. I tricked you. Frequent urination is what happens when someone has hyperglycemia. So the correct response is D. Hypoglycemia or low blood sugar often presents with confusion, shakiness, sweating, and weakness. And I'm going to mute for a moment. All right, so there's a loud noise outside. I do apologize. Question number 12. Which is the correct method of disposing soiled linens? And that says solid, but it should say soiled. Is it A, place them on the floor until the trash is emptied? B, shake them out to remove any loose particles? C, place them directly into the laundry hamper without shaking? Or D, leave them on the bed until the supervisor arrives? What is the correct response, team? If you chose C, you are correct. You want to place them directly into the laundry hamper without shaking. Otherwise, whenever you shake your linens, not only are you spreading contaminants, but you're also dropping probably bodily fluid and other things onto the floor. So if you know that you have to clean someone's linens, if there's not already a laundry hamper or a laundry bag in the room, make sure you bring it in the room whenever you bring the additional linens. Question number 13. What should you do if you notice a small cut on your hand before starting your shift? Is it A, ignore it and start your shift? B, cover it with a bandage and wear gloves? C, report to your supervisor and go home? Or D, wash your hands thoroughly and start your shift? What's going to be the safest for you and your patients? Looks like Tabby says B, Sophia says C, Barb says B. I have a lot of B's. And Yeah, you don't get to go home because you have a cut on your finger. We need you. We're going to cover it. Make sure you wash your hands first and cover it with a bandage. And they sometimes just have like finger covers, which is pretty much like kind of like a glove, but it's just over that one finger. So a cut should be covered with a bandage, and gloves should be worn to prevent the infection or transmission. And I'm sorry it's so loud out there, you all. Question 14. A patient with Alzheimer's disease becomes agitated during care. What is the best course of action? Is it A, restrain the patient immediately? B, leave the patient alone to calm down? C, ignore the behavior and continue the care? Or D, speak calmly and attempt to redirect their attention? I love that emoji, Sapphire. Yes, yes, yes. Everyone chose D. So, speaking calmly and redirection are effective in managing agitation in patients with dementia and also Alzheimer's. And I know I pronounced it Alzheimer's, but it's Alzheimer's. Question 15. What should a CNA do if a patient refuses care? Do you A, force the patient to comply? B, leave the patient alone and chart the refusal? C, report the refusal to the nurse and respect the patient's decision? Or D, call the family for assistance? Miss Nancy refuses her bath today. What is the best response? Yes, Nick Bell. Yes, I think it's Chidi or Chidi. Anna K, Carlene, Marcia, Asata, Karen, Sham, Sheena. Everybody had the correct response. It is going to be C, because patients have a right to refuse care. The CNA should report it to the nurse and respect the patient's decision. But don't forget that the CNA could also be charged with neglect. So don't forget to document this person's refusal and the name of the nurse you reported the refusal to. Documentation matters. Question 16. Which of the following best describes standard precautions? Is it A, using gloves at all times, B, wearing gloves only when dealing with known infections, C, treating all blood and bodily fluids as if they are infectious, or D, avoiding contact with patients who are on isolation precautions? Which best describes standard precautions? I saw a B, I see a lot of C's, I see a A. And so I'm revealing the answer in 3, 2, and yes, it is C. So let me just go back. We don't wear gloves at all times. It's specifically if your patient doesn't, if they're not on contact isolation, you can't feel a pulse through gloves. So you would not be wearing gloves when you're feeling for someone's pulse. So that would be an indication when gloves would not be required. It is going to be C. You're going to treat all blood and their bodily fluids as if they are infectious. And so you're going to wear gloves when needed. And you're also going to be providing hand hygiene before and after patient care. Question 17. Which of the following is the best way to prevent pressure ulcers? Is it A, keeping the patient in one position throughout the day? B, ensuring the patient is well hydrated? C, repositioning the patient every 2 hours? Or D, avoiding the use of pillows for support? And this was easy. Very, very good, team. You all know that those patients have to be repositioned every 2 hours because repositioning helps to prevent pressure ulcers by relieving pressure on certain areas of the body. And it's not just every 2 hours, it's every 2 hours and PRN. So if you turned a patient an hour ago and now they're complaining of pain and they're requesting to be turned again, yes, you would turn them before the 2 hours. So we say 2 hours as a rule of thumb, but it could be more frequently depending on how debilitated your patient is. Question 18. A CNA is assisting a resident with dementia in dressing. The resident becomes confused and frustrated. What should the CNA do? A, dress the resident quickly. B, ask the nurse for assistance. C, offer choices of clothing and encourage the resident to participate. Or D, leave the resident to dress alone. Yes, great job. You all are correct. It is C, offer choices of clothing because it helps to maintain the resident's autonomy. You want these patients making decisions. You want to include them in their care. And when you do so, it can help to reduce their frustration. Question 19. What is the most important action a CNA can take to prevent the spread of infection? Looks like this may be repeated. Let's see. A, wearing gloves for all patient care. B, performing hand hygiene before and after each patient encounter. C, using hand sanitizer in place of hand washing. Or D, using personal protective equipment, PPE, at all times. And even though this question is not repeated, I've already given you this answer. So if you chose B, you are absolutely correct. You know that hand hygiene is the most effective way to prevent the spread of infections. Question number 20. A resident is complaining of pain. What should the CNA do? A, administer pain medication. B, notify the nurse. C, ignore the complaint and continue care. Or D, document the complaint at the end of shift. Don't forget that pain is like your fifth vital sign. So if someone has an abnormal vital sign, what are you going to do? You are going to do B. You're going to notify the nurse. CNAs are not authorized to give medications, so the nurse must be informed so they can assess and address the patient's pain. What can a CNA do? You can reposition. If there's an order for a cold compress, you can apply a cold compress. You can elevate the extremity. You can reassure the patient that the nurse is en route. So there are things you can do when someone's in pain other than besides giving medication. Question 21. What is the most appropriate way to address a patient with respect? So let's say we have a transgender patient. Do you want to A, use their name without asking? B, call them by their room number? C, refer to them as honey or sweetie? D, address them by their title, Mr. or Ms, and last name unless they request otherwise? That is correct, team. Yes, yes, yes. It is going to be D. All right. So, hello, Miss Mary. Even if, whatever it is or whoever it is, excuse me, whatever's in their chart is what you want to go by until they tell you otherwise. And so, addressing patients formally shows respect unless the patient prefers a different form of address. Question 22. A CNA notices that a patient's skin is red over a bony area. What should the CNA do? A, massage the area to improve circulation. B, notify the nurse. C, apply a warm compress. Or D, cover the area with a blanket. I didn't trick anybody. I'm so proud of you. It is going to be B, notify the nurse. Let's talk about if there is redness on top of a bony area, you don't want to massage it because you're going to cause more friction to that area. You also don't want to apply a warm compress because when something is warm, it increases blood flow, but it could also increase inflammation. So the best rule of thumb is that is not your role. That's not your scope of practice. What you want to do instead is exactly what you chose to do. You chose to notify the nurse so that she can come in and assess the sign of a developing pressure ulcer. Question number 23, and we're going all the way to 75 today, team. When performing oral care on an unconscious patient, the CNA should A, use a toothbrush and toothpaste. B, position the patient on their back with the head elevated. C, use a small amount of water to avoid choking. Or D, use an oral sponge and position the patient on their side. Looks like Tasha says D, Gisette says D, Marcia, Fury, Chidi, or Chidi, I apologize. Maricela, everybody said D. So you know that whenever someone's unconscious, they may not have a gag reflex. And so if you sit them up and try to perform oral care, there could be a small amount of secretions or water that goes into their airway. And so, but if you have them on their side and you perform the mouth care, the secretions will drain into the cheek area. You can then take a washcloth and tongue depressor if you don't have a suction and put that into the side of their mouth, and you can remove the excess secretions. For our hospitals, we're going to have suction equipment, but right now, Florida's about to be experiencing a wide power outage because of the storm. We still have to provide mouth care to these patients, even without electricity. So when you don't have a suction device, don't forget that you can take a washcloth, tongue depressor, put that in, wipe away the secretions. Never put your finger inside of someone's mouth, even if they are unconscious, because unconsciously they could bite down, and we don't want you injured. Question number 24. A patient's family member asks for information about the patient's diagnosis. What is the correct response? A, provide the family member with the information. B, direct the family member to the patient's medical record. C, inform the family member to ask the nurse or doctor. D, tell the family member that the information is confidential and cannot be shared. Let's put you in the role of that patient's family member, and you want to come in and get information on your father. But the CNA does D, tells you, oh, that information is confidential. We can't share that. So we know it is not D. Instead, what you're going to do is you're going to refer them to the nurse. All right. So C is the correct response. Only nurses or doctors should provide medical information. The CNA should not share or discuss the patient's diagnosis. For example, you can have a patient who has AIDS or HIV, who instead of telling their family members their true diagnosis, will say they have cancer. And so the wife is asking you about her husband's cancer, and you're looking like, this man doesn't have cancer. Shh. HIPAA, confidentiality, refer that person to the nurse. The nurse knows how to ethically deal with that situation. And, and she may even redirect them back to the patient again, because the patient, even if they're married, we still have to have permission to talk about their diagnosis and their information with others. Question number 25. How can a CNA promote dignity when assisting a resident with toileting? Is it A, leave the door open in case the resident needs help? B, provide privacy by closing the door and pulling the curtain? C, stay in the room at all times? Or D, speak loudly to encourage the resident to hurry? All right, Miss Nancy, I have 15 patients. Hurry up. All right, so we know that we're not going to do D. But what you're going to do is B. You're going to provide privacy by closing the door and pulling the curtain. This helps to maintain the resident's dignity. Question 26. A resident who has been bedridden for several weeks suddenly complains of chest pain and shortness of breath. What should the CNA do first? Is it A, help the resident sit up and offer water? B, notify the nurse immediately? C, encourage deep breathing exercises? Or D, provide reassurance and monitor closely? Patient has chest pain and shortness of breath. You are aware that this is a medical emergency, so you're going to do B. You're going to press that panic button that's on that wall. Usually we don't use the call bell in case of emergency, the handheld device. That's the slow way to get help. You're going to hit that panic button on the wall or pull the cord in the bathroom. That way it alerts throughout the entire floor, because that could be a sign a person's having a heart attack or that they have a clot in their lungs, and we refer to that as a pulmonary embolism. So they need to be seen right away. Question number 27. The CNA is feeding a resident who is at risk for aspiration. What is the best position for this resident during meals? Is it A, supine, B, reclined at 30 degrees, C, sitting upright at 90 degrees, or D, lying on their side? You're feeding someone who's at risk of having food going into their lungs. What is the best position? All right, so Livia says C, Marie says C, R.A. Nick Bell, D. Lugo. I hope I pronounced that correctly. So great job, everybody. C is right. So you're going to put them in a high Fowler's position. So positioning the patient upright at 90 degrees helps to reduce the risk of aspiration by allowing food and fluid to move down the esophagus properly. And so if you stay for this long, I need you all to hit that like button because we have a lot of questions left. We're doing a full 75 practice CNA question review before this storm because I don't know if I'm going to see you again until after we get lights again. So I need some thumbs up, I need some likes, and also some shares, and I appreciate you. Question 28. A CNA observes another staff member physically restraining a resident without proper authorization. What should the CNA do? Is it A, assist the staff member in restraining the resident? B, ignore the situation if the resident is combative? C, ask the staff member for an explanation? Or D, report the incident to the nurse immediately? I'm so proud of you all. I'm so proud of you all. You know that person, a CNA, cannot authorize the use of a restraint. The nurse has to contact the doctor. So the correct response is going to be D. You need to report that incident immediately because that is the use of restraints without proper authorization, and that's a violation of the patient's rights, and that should be reported. Remember, we are mandatory reporters. Question 29. When should a CNA wear gloves? Is it A, when feeding a resident, B, while performing oral or perineal care, C, when taking a resident's temperature, or D, while speaking with a resident? When do you want to wear gloves? Which of those tasks are the most contaminating? That's what I want you to think about if you see a question like this on your test. So the one that is the most contaminating is, of course, going to be, yes, Novelette, yes, Chioma, it is B. You want to wear gloves while performing oral and or perineal care because you're going to be in contact with bodily fluids, and those gloves help to protect you as the caregiver and then also your resident from infection. Question number 30. What is the best way for a CNA to measure the height of a resident who is bedridden? Is it A, do you want to guesstimate? Is it B, do you want to ask the resident how tall they are? And don't forget, with like older age and osteoporosis, remember once an adult, twice a child. So you reach your peak height, but then as you age, you get shorter. So do you want to do C, guess based on the resident's appearance, or D, measure from head to toe while the resident is lying flat in bed? And I see so many correct responses. So yes, the correct response is D. When someone is bedridden, lay them flat. Get your measuring tape out. Yes, we have measuring tapes in our facilities, and the height should be measured by using a tape. And you're going to take it from the head of the top of their head to the bottom of their feet while they are laying flat. They cannot be sitting upright when you're trying to measure their height. Question number 31. A CNA notices that a resident with diabetes has not eaten most of their meal. What is the CNA's best action? Do you want to A, force the resident to eat, B, remove the tray and document intake, C, encourage the resident to eat and inform the nurse, or D, offer the resident a different meal? I see a lot of D's. I see some C's. You know what? I'm going to agree with you all. I see the way that you're thinking. So maybe they did not eat most of their food because they didn't like the food choices. So I can see why you chose D. But then we know that they're diabetic. So if they don't eat their food, their blood sugars are going to drop. So, okay, it is C, but I'll give you honorable mention if you chose D. So C is important for the residents with diabetes to maintain proper nutrition. Why feed your patients while wearing gloves? Without For sham, think about those people who work in assisted living facilities. So there is one tech or one CNA and maybe 20 residents. And that tech is with clean hands, is helping 10 people with their trays. So when you're assisting someone with feeding, I know it would make sense to wear gloves, but it's not a requirement, because if you're not physically putting your fingers to their mouth, if you're only touching a spoon or a fork, you don't have to wear gloves for the feeding skill. So I hope that helps to explain that better for you. So C, encourage the resident to eat and inform the nurse, because with diabetes, if that person doesn't eat, their blood sugar could drop. So always let your nurse know so that we can be monitoring their blood sugar levels more carefully. Question 32, which of the following is the correct response if a patient falls while you are assisting them with ambulation? How scary. Do you want to A, try to catch the patient to prevent the fall, B, ease the patient to the floor and call for help, C, run to get assistance before helping the patient, or D, pull the patient up immediately? So proud of you. Yes. So you all know that you're going to be easing the patient to the floor. At no point will you try to prevent a patient's fall, because if that patient falls on you, there was a CNA, she was walking somebody who was 300 pounds, and I'm going to say that she was probably 120 pounds, and she tried to break his fall. And in trying to break his fall, he fell on her and she went backwards and broke both of her kneecaps. So if you can, ease them to the floor. Never stand them up. Don't try to use your body to break their fall. Get them to the floor. That's not a fall. That would be an assist. And then once you gently lower them to the floor, that's when you can call for assistance. Do not try to get that person up by yourself. You need to wait for the nurse to come and assist you. Question 33, a resident with dementia begins to shout and act aggressively toward staff members. What is the CNA's best response? Is it A, shout back at the resident to get their attention, B, restrain the resident until they calm down, speak calmly and use short, simple instructions, D, ignore the resident's behavior and continue care? They're shouting, leave me alone. What are you going to do? If you chose C, you understand that staying calm and using clear, simple communication can help de escalate aggressive behaviors in residents with dementia. Question 34, what is the purpose of the Heimlich maneuver? Is it A, to provide CPR, B, to check for consciousness, C, to dislodge an object from the airway, or D, to check a pulse? Yes, Nick Bell. Yes, everybody. Tasha, Cephaclean. Yes, you're absolutely correct. We perform the abdominal thrust, previously referred to as the Heimlich maneuver, to help dislodge an object when a person is choking. So when you say, hey, are you choking? If it's an adult or an older child, they may be doing the universal choking sign. They can't cough. If they were able to cough, you'd encourage them to cough. If they're doing this and they cannot cough, that is when you're going to be performing the abdominal thrust. And of course, you're screaming out for help at the same time. Question 35. What is the appropriate action if a resident's catheter becomes disconnected from the drainage bag? Do you want to do A, reconnect the catheter without using gloves? B, wipe off the tubing with an alcohol swab and reconnect it? C, do nothing and wait for the nurse? D, remove the catheter and insert a new one? Let's see, we have B's, we have C's, we have a lot of C's. And so I understand why you all are fearful of a catheter, because you've been taught that you can't insert catheters. This is an insertion. This is the part that is external. It has now disconnected. And so you don't want that urine seeping out. What you want to do instead is B. You want to wipe off the tubing with an alcohol swab and reconnect it, because the longer that is disconnected, it could be on the floor. Okay. And so now we have air going into this person's bladder, urine going to the bed. Wipe the part that is disconnected off with an alcohol swab, let it air dry for 10 seconds, reconnect it. That way, by the time your nurse enters the room, that system is already closed up. And then the nurse will determine if the person needs to get a new catheter inserted. So the rationale states if a urinary catheter tubing disconnects, it is important to wipe it off with an alcohol swab before reconnecting to reduce the risk of introducing bacteria into the urinary system, which can cause a urinary tract infection. The alcohol swab disinfects the catheter tubing, ensuring that the connection remains as sterile as possible while you're waiting for that nurse to enter the room. It may be about 3 to 5 minutes before that nurse can get into that room, and I don't want to see urine just going everywhere while you're waiting for the nurse. So alcohol swab, reconnect, and then your nurse will direct you further. Question 36. When transferring a resident from a bed to a wheelchair, what safety measures should the CNA take first? Is it A, lock the wheels on the wheelchair, B, position the resident's feet on the footrest, C, position the wheelchair far from the bed to ensure a longer walk, or D, raise the bed to a high position? I need all correct answers for this one. Are you a safe caregiver? And yes, all of you are safe caregivers. You know that even when you're starting this skill for your CNA exam, after introducing yourself, I need you to get that wheelchair and lock the brakes. Locking the wheels on the wheelchair ensures it remains stationary during the transfer, thus preventing accidents. Question 37. A CNA notices that a resident is taking longer than usual to urinate and appears to be in discomfort. What should the CNA do? Is it A, ignore it as some residents take longer to void? B, encourage the resident to drink more fluids? C, report the observation to the nurse? D, help the resident change into clean clothes? What does that have to do with painful urination? Nothing at all. So since we know it is not D, I see a whole bunch of you all who have selected the correct response, which was C. You're going to report the observation to the nurse because difficulty or discomfort with urination could be a sign of infection or another medical condition. So it should be reported to the nurse for further evaluation. Question 38. Which of the following is an example of neglect? Is it A, assisting a resident with bathing, B, leaving a resident wet after an episode of incontinence, C, turning a resident every 2 hours, or D, responding promptly to a call light? I see A, B, C. Now I see a whole bunch of B's. So neglect, think of something where they would call the state on you as a caregiver. And so as a caregiver, if it's not intentional, if it's because you were busy and you're going to address it, that wouldn't necessarily be a sign of neglect. But if you are intentionally doing B, leaving your resident wet after they have urinary incontinence, that would be neglect because you're putting them at risk of skin breakdown and infection. When we say skin breakdown, it may start off as like a diaper rash, but that diaper rash can lead to a pressure sore. So do not leave your residents wet. Question 39. The CNA notices that a resident has not had a bowel movement in 3 days. Oh, that's bad. What should the CNA do? A, offer the resident a high fiber snack. B, give the resident a laxative. C, notify the nurse of the resident's condition. D, wait another day before reporting it. Yes, Safi Clean. Yes, Sham. Yes, Nick Bell, Livia, Isata. You are correct. We didn't notify that nurse. So let me tell you, when we try to give people like oral medications, if that stool is blocking, okay, if it's in their colon and it's blocked up, we give them all the oral medications in the world. It's not going to push that stool out. So then that's when we go through the rectum and we give enemas and suppositories. So our job as healthcare professionals is to prevent them from being constipated, get them up, get them moving, give them fiber, all that stuff we're supposed to do. And now 3 days in, this person hasn't had a bowel movement. Your nurse may have to put on gloves, lube up her fingers, and literally go in there and manually disimpact and remove the fecal matter. That is uncomfortable for the person who is being disimpacted. It's also uncomfortable for us as healthcare providers. So at no point should your patients be going 3 days without the bowel movement. On day number 2, please be letting your nurse know so that they don't become so constipated until they have an obstruction in their bowel. Question number 40. A CNA is caring for a resident who is terminally ill. What is the best approach to care? Is it A, encourage the resident to be active, B, focus on providing comfort and support, C, avoiding discussing death or dying with the resident, C, offer only medical interventions? This person may have lung cancer. They're more than likely a DNR, which means do not resuscitate. You don't want to leave them isolated. You don't want them to be in pain. What you want to do instead is B. You want to focus on providing comfort and care. So care for terminally ill residents should focus on comfort, dignity, and emotional support rather than aggressive medical interventions. But that's just not for the patient, it's also for their family too. And so that is when they will usually consult hospice. But until hospice is consulted, we still are going to be providing that care while they're in the hospital. Question 41. When performing perineal care for a female resident, the CNA should wipe A, from back to front, B, from front to back, C, in a circular motion, or D, side to side. If you do C or D, they're calling the authorities on you. That would be very inappropriate. So A puts them at risk of a UTI because of improper wiping. You would be taking fecal matter and pulling it towards their vaginal area. So the correct response whenever you're cleaning a female, you start from the vaginal area and then wipe down. And every time you re-wipe, think of when you're using toilet paper. Anytime you re-wipe, you change positions on your washcloth. So you never touch them with the same surface area twice. And there we go. Our correct response is B as in boy. Question 42. What should a CNA do if a resident begins to have a seizure? Is it A, place a tongue depressor in the resident's mouth, B, restrain the resident, C, call for help and move objects away from the resident, or D, leave the resident alone until the seizure is over? I know this is tricky. I saw some B's, but now I see a lot of C's. And so when someone is seizing, you're supposed to do C. You're going to call for help and move things out of the way. You're not going to try to hold them down, because if you're trying to hold someone down while they're seizing, you're actually causing more damage. You can cause nerve injury. So during a seizure, the CNA should protect the resident from injury by moving objects away and ensuring help has been called. So let's say you have somebody who's thrashing about in their bed and they're having a seizure. Of course, you're not going to let down the side rails. What you would do instead is get pillows, blankets. You would go ahead and put those against the side rails. That way, when the resident hits the side rail, they don't cause any injury. And then, of course, once the seizure is done, the nurse is in the room, the nurse is more than likely going to have you go to the central supply area and get padding for the rails, because now we have this patient on seizure precautions and their rails must have padding on them. Question 43, and I am so proud of you all. Which of the following is a key sign of dehydration in a resident? Is it A, frequent urination, B, dry mouth and cracked lips, C, sweating excessively, or D, swollen hands and feet? Marie, Zilma, Joseph, Shanice, Zawadi, Livia, Tasha, Claude, Karen, Panda, Cookie, Fatima, Ellen, Beverly. Great job, everybody. Dry mouth and cracked lips and also reduced urination are common signs of dehydration and they should be reported to the nurse. The correct response was B as in boy. Question number 44 of our 75 questions. So if you haven't hit that like button yet, I need you to do so. Question 44. A CNA is assisting a resident with left-sided weakness to walk. Where should the CNA stand to offer support? Is it A on the resident's left side, B on the resident's right side, C in front of the resident, or D behind the resident? I see A's, I see B's, I see A's. Let's see, I see some more B's. So we are torn between A and B. And remember, when someone is weak, you don't want to help them on their strong side because their weak side is going to be dragging. So if somebody has a side that is weak, that is the side that you should be supporting. So the correct response is going to be A. They had left-sided weakness. I need my CNA on the left side. So the CNA should stand on the resident's weaker side to provide support and to prevent falls. Question 45. What is the best way to prevent the spread of infection when providing care for a resident in isolation? Is it A, avoid touching a resident, B, use proper personal protective equipment or PPE, C, wash hands only when leaving the room, or D, double glove during all care tasks? I see A's, I see B, I see C's, I see more B's than I see anything else. Now the consensus is B's. And so revealing the answer in 3, 2, and yes, it is B. So using PPE such as gloves, gowns, and masks according to isolation protocol helps to prevent the spread of infection. And so let's tell you why it wasn't D. We don't double glove. According to the CDC, that is not anything that is required. They may have double gloved during the pandemic, but outside of that, we are not double gloving. And then you don't want to, A, avoid touching a resident. If someone's in isolation, you can touch them. You're just going to have on the proper PPE. You're going to have on your gloves and your gown before you touch them. Question 46. Which of the following actions by a CNA helps prevent pressure ulcers in residents? Is it A, encouraging the residents to drink fluids, B, keeping the head of the bed elevated at 45 degrees at all times, C, repositioning residents regularly and using pillows for support, or D, encouraging residents to stay in one position for hours? Look, it's hard for me to sit down this long to do this 75 question practice CNA exam. So I couldn't imagine being a patient who's just laying in one position for hours. So of course we're not going to do D. It is going to be C. You're going to position or reposition them regularly and then use those pillows to help relieve pressure on the bony areas, thus reducing the risk of pressure ulcers. All right, and so now something else that I want to say is I'm in a couple of the CNA groups on Facebook, and I see some CNAs who I may not have encountered who are saying they have failed the written test multiple times. For you all, it's usually the clinical skills that's easy because it's more muscle memory. But for this written test, if you are finding that having someone read the test to you and give you an explanation actually helps you to understand the test questions better, don't forget that when you're taking your CNA exam, you can ask for an audio earpiece. Yes, you can press play, only you can hear it, and the questions and the answers will be read to you. So I'm finding that for some of you all, you may have dyslexia that may have not been diagnosed, or you may have reading concerns. And so it is okay to ask for the audio test when you're taking your CNA exam, just to make sure that you're able to pass, because once you're a CNA, your patients are not asking you to read to them. So, question 47. The CNA is helping a resident with Alzheimer's disease to dress. The resident is confused and trying to put on two shirts. And I think it was Joseph. Let me go up. I just missed something. You're so welcome, Joseph. The CNA is helping a resident with Alzheimer's disease to dress. The resident is confused and trying to put on two shirts. What is the best action for the CNA to take? Is it A, allow the resident to wear two shirts, which is what I probably do, and that's totally wrong. I would fail the CNA test. Is it B, correct the resident's mistake by removing one shirt? C, take over and dress the resident quickly? Or D, offer two clear clothing choices to assist the resident? Don't do A. Don't be like me. The path of least resistance. I'm not arguing with Mr. Brown today. He want to put on two shirts. I'm going to let him put on two shirts. The correct response, everybody, is going to be D. Offering simple choices helps the resident maintain independence while minimizing confusion. Question 48. A resident who is nonverbal shows signs of discomfort by grimacing and moaning. What should the CNA do? A, ignore the behavior since the resident cannot speak. B, offer pain relief medication. C, report the behavior to the nurse and observe the resident closely. D, reposition the resident and ask if the pain has subsided. You all know that that is the correct response. So yes, it is C, because nonverbal residents may show discomfort through facial expressions, moaning, maybe they're guarding, they're holding a joint or an extremity, and that should be reported to the nurse for assessment and intervention. And so if they can't tell you their pain level, don't forget the Wong-Baker scale. It has the smiley faces to the crying faces. You can have them point, or you can say thumbs up if you're okay, thumbs down if you're in pain. So there are other ways to communicate with your patients who are nonverbal, and you want to be thinking about how best to communicate with them. Question number 49. How should a CNA respond if a patient with dementia repeatedly asks the same questions? What time is lunch? What time is lunch? Is it A, answer the question each time calmly and patiently? B, ignore the resident? C, yell at the resident to stop? D, redirect the resident to another activity? Tasha, Sham, Judith, Safira, Zawadi, Ellen, Claire, Shioma, great job, team. You all are going to do A, because you know that repetition is common in dementia patients, and answering questions calmly helps reduce frustration and provides reassurance. And what you can do is you can point to the clock as a reminder. And hey, Miss Lucille, don't forget that when it's 12 o'clock on the clock, that's what time lunch is. So when she comes back over and says, hey, what time is lunch? Point to the clock again. And so you're helping to reorient her, but also helping her to utilize the resources so that she can be aware of the time. Question 50. A CNA is assisting a resident who is visually impaired with eating. Which of the following is the best way to describe the location of the food on the plate? Is it A, point to the food on the plate? B, use the clock method to describe the location of the food? C, feed the resident without explanation? D, place all of the food in one area? Oh, how do you feed somebody who is legally blind or who has a visual impairment? I see A's and I see a lot of B's. So for this one, for some of you all, it may be new knowledge, but whenever you're feeding somebody with a visual deficit, when you set up their plate, you want to set it up like a clock. So the solid items will be at 12. So maybe we have a piece of chicken, green beans at 3, rice at 6, biscuit at 9. With their clean hands, they can touch the parameter of their plate, or they can touch the actual food objects. And so, as I said before, B is the correct response, because using the clock method, such as your potatoes are at 3 o'clock, helps visually impaired residents understand where their food is on their plate. If a person has a visual impairment, it doesn't mean that they're unable to feed themselves. it means they need assistance, and you assist them by helping them with the orientation of the foods on their plates, adding the condiments, the salt, the sugar, whatever else they need, watching them take one bite, of course, making sure they're sitting upright, putting a towel on their chest. And once you've assisted them and they start eating, now you can go to your next patient. Question 51. A CNA notices that a resident with diabetes is sweating profusely and has shaky hands. What is the what is the first thing the CNA should do? Is it A, check the resident's blood sugar level, B, notify the nurse, C, help the resident to bed, D, take the resident's blood pressure? I see A's, I see B's, I see a lot of B's. Revealing the answer in 3, 2, and all right, my super CNAs, just because you know the blood sugar's low, you still got to notify the nurse. All right, so it's going to be B. You're going to notify that nurse because sweating and shakiness in a diabetic resident could indicate hypoglycemia or low blood sugar, which requires immediate nursing attention. So here it is. You're just in there. You never notified the nurse. You're in there pricking the finger. Now the patient's unconscious. You still haven't notified the nurse. Meanwhile, the nurse could have came in there, started the IV, got the D50, start pushing it in the IV line so the patient can improve. So remember, as a CNA, you assist the nurse. You are not the nurse. So anytime there's a change in a patient's condition, you have to notify your nurse, okay? Even though you know what to do initially, you can't do those advanced tasks such as push direct medications. Question 52. The CNA is transferring a resident using a mechanical lift. What is the most important safety check before starting the transfer? Is it A, make sure the resident is holding the sling? B, check that the sling is positioned properly under the resident? C, ensure that the wheels of the lift are unlocked? D, ensure the resident is able to stand independently? And if they were able to stand, you would not be lifting them. So we know it's not D. Let's see what responses we have in the chat. We have a lot of B's and we have C's. So anytime there is a device and an answer option mentions unlocked, we never want to unlock something that we're about to put a patient in. So the correct response is going to be B. You want to make sure the sling is positioned properly under the patient because this is going to be hoisting the patient up. And you don't want the patient halfway hanging out of it. So the rationale states the sling must be properly positioned under the resident to ensure a safe transfer using a mechanical lift. And I don't care how short-staffed your facility is. Anytime you're using a mechanical lift, aka a Hoyer lift, it requires 2 caregivers, one to work the device, one who actually has hands on this patient as we're transferring them from one location, such as the bed, to another, such as their geriatric chair. Question 53. What should a CNA do if they notice a resident with an unsteady gait attempting to walk alone without a walker? Man, Miss Eunice will not stay in the bed. Is it A, assist the resident immediately and report the situation to the nurse? B, allow the resident to continue walking without assistance? C, tell the resident to sit down immediately? Or D, ignore the resident and continue with the other task? What are you going to do with that super independent patient who doesn't want to wait on you? Yes, we're going to still help him or her because at the end of the day, safety is important and we don't want this person falling. So the CNA should provide assistance to prevent falls and report the incident to the nurse for further evaluation of the resident's condition. So what's going to happen? Bed alarms. She's now going to have a bed alarm. So that way, whenever her position changes and she's trying to get up out of bed, it's going to alert and that's going to signal for you to get into the room quicker. And if you're unavailable, then of course the nurse will go into the room. Question 54. A resident complains of shortness of breath while lying in bed. What should the CNA do? Is it A, help the resident sit up in bed? B, ask the resident to drink water? C, call 911 immediately? D, leave the resident alone to rest? Let me do my crazy nurse dance. Yes, yes, sit them up. Sit them up as you're calling for the nurse. Sit them upright because sitting up can help improve lung expansion and ease breathing for residents experiencing shortness of breath. Now, you ain't got to wait for the nurse to tell you to raise somebody up who's short of breath. You press that panic button and you get them upright. And then, if you can, if you have the extra equipment in the room already, go ahead and start taking those vital signs, which should also include the pulse ox. You want to get their O2 set. So if you have that equipment in the room already, go ahead and utilize it. But what you cannot do is you cannot increase the flow of oxygen, and you cannot leave that patient alone in the room to go and get the blood pressure equipment and or the pulse ox. Someone else is going to have to bring that into the room for you. Question 55, which of the following task is within the CNA scope of practice? Is it administering medication, inserting a catheter, monitoring vital signs, or diagnosing a medical condition? What do you think, team? What do you think? Let's see. Deanne says C. Aura says C. Ellen May says C. Marie says C. Panda Cookie says C. Nichelle. Everybody, you are correct. That is within your scope of practice. So CNAs are responsible for monitoring and reporting vital signs, but they are not authorized to administer medication or make diagnoses. So for this question, the correct response was C. Question 56. When making an occupied bed, the CNA should A, lower the side rails for easier access, B, ask the resident to sit in a chair, C, keep the resident covered during the procedure, or D, move the resident to the floor to ensure safety. If you do D, you will not be a CNA for long. So let's see what these answer options are. I am so proud of you. Everybody chose C. You're going to keep the resident covered during the procedure. Remember that the response as far as lowering the side rails for easier access, if you're going to lower the side rails when you are assisting someone who's in the bed, you're only going to lower the side rail on the side that you are working on. And before you turn away, before you walk away, you have to raise that side rail. And then you walk around to the opposite side of the bed, you will lower that rail and repeat the process. Question 57, and for those of you all who have stayed from the beginning, I am so proud of you. For those of you all who have just joined in the center, don't forget to go back and watch the whole video. And then next week, I think we're going to be doing the ones on capillary and arteries. We also will be doing one on medication management. So question 57, what is the first step a CNA should take when they find an adult unresponsive and not breathing? Unresponsive and not breathing. Is it A, start chest compressions immediately, B, give 2 rescue breaths, C, call for help and activate emergency response system, D, check the pulse for 60 seconds? This one's tricky, you all. I see C's, I see D's. Rule of thumb, whenever there is a change, your patient has a change in level of consciousness, what do you need to be doing? Now I'm seeing the right answers. You want to call for help. You want to do C. And when it says activate the emergency response, it's because it doesn't know where you're working. Because if you're in home care, activating the emergency response is that you're picking up your phone, you're calling 911, you're leaving it on speakerphone, and then the dispatcher will give you further directions. If you are in a home setting, if you're in a hospital setting or a nursing home, you're going to press the code button or the panic button. So the rationale is that the first step in the chain of survival is to activate the emergency response system to ensure that advanced care arrives as quickly as possible. Immediate action is critical in increasing the chance of survival, while compressions and rescue breaths are important. Ensuring help is on the way should be the priority. Question number 58. When performing chest compressions on an adult, how deep should each compression be? Is it A, 1 inch, B, 2 inches, C, 3 inches, or D, 4 inches? How deeply do you want your chest compressions to be? And Neo Us says B. Safiri says B. Asata says B. Karen says B. Shioma says B. So it looks like everybody knows that you have to compress 2 inches on an adult. And so the response is going to be B. And the rationale says that for effective CPR on an adult, compression should be at least 2 inches to ensure that adequate blood flow is circulating to vital organs like the heart and the brain. Compressing too shallowly may not be effective, and compressing too deeply could cause harm. So 2 inches is the golden rule for adults. Question number 59. The CNA is instructed to assist a resident with passive range of motion. This means the CNA should A, guide the resident through exercises without their assistance. B, ask the resident to perform the exercise alone. C, encourage the resident to perform exercises quickly. Or D, perform the exercises while the resident is sleeping. It's like Stephanie says B, Zilma says C. Revealing the correct response in 3, 2, 1. And here's the correct response, everybody. If you chose A, you know that we want to guide the resident through the exercises without their assistance. So passive range of motion involves the CNA moving the resident's limbs through the range of motion exercise without active participation from the resident. So if you're thinking about active range of motion, that is when the patient can help you. So if you say, hey, Eunice, I want you to raise your arm 3 times independently, that will be active. But if you have to provide support, like on the CNA examination, that will be passive range of motion. Question 60. When providing catheter care, the CNA should clean the catheter, A, from the drainage bag towards urethra, B, in a circular motion around the catheter, C, from the urethra outward going away from the body, or D, using only water without any soap. Which direction do you clean the catheter tubing? So I see A's, I see a D, I see B's, I see a C. Oh, you all gave me the full alphabet. So think about that catheter, that flexible catheter that should be draining independently. You never want to start off at the bag and then take all those germs and then go towards urethra. And you don't want to go in a circular motion, because every time you wipe, you should be changing positions. Let's say she was on her cycle. Let's say she was bleeding. And so you're just going in circular motions. You're just wiping around blood. That is nasty. So the correct response for this one, whenever you're providing catheter care, is going to be C. You're going to wipe from urethra. Remember, you're going to secure that catheter and wipe down, going away from the body. So cleaning the urethra outward prevents contamination and reduces the risk of urinary tract infections. And we do have a whole video playlist on the clinical CNA skills. And so if you can't find it, just go to YouTube, type Florida Training Academy catheter care, Florida Training Academy perineal care, because we have a full playlist with all of the CNA skills to help you pass not only your exams, but to help you be better caregivers in the real world. Question 61. When performing CPR, how often should you switch roles with another responder to avoid fatigue? Is it every 1, 2, 5, or 10 minutes? How often do you switch? I see A's, I see 2, I see C. Revealing the answer in 3, 2, and that tells us that we have to do a better job, because I know what you see in the facility. You see that one male tech on that chest nonstop, medic, military. He's just doing those chest compressions. But if you're doing CPR according to the American Heart Association guidelines and protocols, you're going to be switching compressors every 2 minutes. So the correct response should be B. High quality compressions are essential for effective CPR. To avoid fatigue, it is recommended to switch roles every 2 minutes or sooner if the responder becomes tired. Fatigue can reduce the effectiveness of compressions, leading to a decrease in the patient's chance of survival. Question 62. A resident's family member complains that their loved one is not receiving adequate care. How should the CNA respond? Do you want to A, argue with the family member, B, tell the family that you are doing the best you can, C, listen to the family member's concern and report them to the nurse, or D, ignore the complaint? Look, I know in those nursing homes that sometimes the nurse has 30 patients, the LPN has 30 patients. So that means that you have 30 patients. And no, you can't be everywhere. But if you are in a room and a family member is voicing a concern, I need for you to be concerned. You need to be in the moment. So the correct response is going to be C. Great job. You're going to listen to the family's concern and report the concern to the nurse. That way, the issue can be addressed appropriately. It may not be addressed quickly because, again, both of you all have 30 patients, but at least take the residents or the family members' concerns seriously and show empathy. Question 63. Which of the following is an example of a restraint alternative? All right, so we don't have an order for a restraint on this patient, so we need to use a restraint alternative. Is it A, using a physical restraint on the resident, B, providing a calming environment and frequent toileting assistance, C, keeping the resident in bed for long periods, or D, restricting the resident's access to food and water? Yes, Tasha. Yes, Sheedy. Yes. Yes, Susan, Karen, Neosa. Sorry if I said that incorrectly. Celia, Quinese, Nikisha, Nick Bell. You are absolutely correct. So as a CNA, no, you just can't go and restrain people. What you can do is that little busybody person, get them up, get them to the bathroom, frequent toileting. So the correct response is B. Restraint alternatives aim to prevent the need for physical restraints by addressing underlying needs such as comfort, safety, toileting. Don't forget hunger. So maybe providing them with a snack will distract them. Question 64. When dressing a resident who has a weak right arm, which arm should be dressed first? Is it the left arm, the right arm? It doesn't matter. Both arms at the same time. All right, Miss Eunice, I know your arm is weak, but raise them both up. That didn't make sense. So, which arm do you dress first? If you have a resident or a patient who's had a stroke, do you dress the affected extremity first or their good extremity first? Revealing the answer in 3, 2, and for this one, the right side was weak. So you want to start dressing with the right side. So let's say a person had a sling and you need to put them in traditional clothing. So you would have to support that arm, dress that arm first, walk around, and now with their arm that moves more, they can assist you. If you do it the opposite way and you use the good arm first, by the time you bring the jacket around to the front, there's not enough room to put that injured arm into the sleeve of that jacket or that shirt. So whenever you're dressing somebody with a weakened extremity, you dress the weak side first. Whenever you're walking somebody with a weakened extremity, you support the weak side. So I hope that's making sense and it will help you pass your test. Questions start with the weak side. Yes, ma'am. Yes. Is it Consia? All right. So question 65. What should a CNA do if a resident suddenly becomes confused and disoriented? I need all 90 of you all to give me the correct responses. Do you want to restrain them because they're confused? Do you want to calmly reorient them and notify the nurse? Do you want to leave them alone until they calm down? Or do you want to force them to lie down? Yes. All right, so let's talk about reasons that a person can become disoriented quickly. So you're going to try to reorient them, but if they are disoriented due to a medical concern such as stroke, low blood sugar, low blood pressure, low oxygen levels, Reassuring them isn't enough. When someone has new confusion, you need to be notifying that nurse, because that's a sign that the brain isn't getting enough oxygen or getting enough blood flow. So notify your nurse for further assessment whenever there's a new change in the patient's condition or level of consciousness. Question 66. Which of the following is a sign of a pressure ulcer? Is it A, redness that does not go away when the pressure is removed? B, pale skin color? C, bruising around a bony area? Or D, cold skin on the limbs? I'll take two answers for this one. This question wasn't worded the best, or at least the responses weren't, because one of the responses could be confusing. So, yeah, we got A, we got B, we have C, and you know what? You all are right. So this wasn't my best question. You are absolutely correct. It is all of those. So it is B, because sometimes with African Americans or people who have a darker skin complexion, we don't turn red. So it could be a paler area, especially on the heels. Bruising, so discoloration over a bony area, could be the sign of a pressure sore. And of course, redness that does not go away once you turn the patient is also a sign of a pressure sore. So for this one, if you chose A, B, or C, thumbs up, because you were smarter than a nurse who did not write this question correctly. So persistent redness, especially over a bony area, is a common early sign of developing pressure ulcers and require immediate attention, as would be a pale area over a bony area. And what was the other one? Bruising over a bony area. So if you see that, go ahead and notify your nurse. Question 67 of our 75 questions. So proud of you. What is the primary purpose of a care plan? Is it to assign blame if something goes wrong? Is it to ensure the resident is billed correctly? Is it to provide a detailed plan of care required for each resident? Or is it the last one, D, to record the resident's dietary preferences? Yes, and when you're in nursing school, you're going to get so tired of writing care plans, but it's muscle memory and you understand the concepts. So the correct response is C. A care plan outlines the specific needs of a resident and provides guidance on how those needs should be met. Question 68. A resident has refused to eat their breakfast. What should you do? Do you A, force the resident to eat, B, offer the resident a snack later, C, respect the resident's refusal to eat and inform the nurse, or D, remove the tray and do nothing? Yes. Look, us nurses and CNAs and healthcare providers, doctors, nurses, firefighters, we usually don't eat breakfast. You know what we eat for breakfast? We drink coffee. So imagine us once we're, older and we're hospitalized and you bring us breakfast. We just probably going to drink the coffee still. So you want to respect the resident's right to refuse and inform the nurse. All may be well. Maybe the person just doesn't naturally eat breakfast. But if this person is refusing breakfast, lunch, and then dinner, yes, I like that. Yes, Kancia, she says, C, first you want to respect their right, but then you can also offer them a snack later. So yes, you can do both of those. But yeah, if you don't normally eat breakfast isn't your thing, just document the refusal, notify the nurse, but then maybe offer a snack a few hours later. And then of course, just ensure that they do eat their lunch. Now, if they don't eat breakfast and lunch, now we have a medical concern and that person may be malnourished. And of course, your nurse will take further action. But until then, we're just monitoring the patient. Question 69. A resident tells the CNA that they feel like they are going to vomit. What should the CNA do first? Thank you so much, Celia. Do you want to do A, leave the resident alone until they feel better? B, get an emesis basin and assist the resident to a sitting position? C, offer the resident a glass of water? Or D, call the nurse immediately? I'm revealing the answer in three, two, and everybody got it right. Look, I need for you to help this resident you don't want them laying flat when they vomit. So you're going to sit them up, give them the bath basin. That emesis basin is a little small oval shape or a kidney shaped basin. Usually vomit is projectile. So you don't want to give anyone the emesis basin, even though that's what the question said. Give them that bath basin. Let them put their full face in that bath basin and vomit. Because again, it's projectile. This will, of course, collect all the vomitus. And then when the nurse gets into the room, she can further assess the patient. The patient's probably going to be NPO, which means they can't have anything to eat or drink orally. And then they can give them some anti-nausea medication. So B, assisting a resident into a sitting position and providing an emesis basin or a bath basin will help them manage nausea and prevent them from choking if they vomit. Question 70. A resident asked a CNA to leave the bathroom door open while they use the toilet because they are afraid of falling. What should the CNA do? Do you want to A, leave the door open and stay with the resident? Do you want to do B, close the door to give privacy and leave the resident alone? C, stay with the resident but slightly close the door or curtain for privacy? Or D, lock the door and stand outside? I know. So some of you all answered the questions too fast. Make sure when you take your test that you read all of the answer options because you shouldn't be standing in the room with somebody while they are using the toilet. You can still provide safety, reassurance, and comfort for them by doing C. You can stay with them, but slightly close the door or curtain for privacy. So, all right, Miss Lucas, I understand that you're scared of falling. I'm not leaving your room. I'm going to slightly close your door, and I'm right here behind the door. So just let me know when you are done. You have enough on your plate. You standing in the bathroom while someone is pooping is not necessarily something you want to be doing. So give them their privacy, let them take their time. You stand outside the door slightly cracked so you can watch them so they know you're out there. But then that way, again, you're protecting their privacy and their dignity while keeping them safe and not being trapped in a bathroom with somebody who is either urinating or defecating. Question 71. A resident with a history of stroke is experiencing difficulty swallowing. What is the CNA's best action? Do you want to A, feed the resident solid foods, B, elevate the head of the bed and offer thickened liquids, C, ask the resident to drink quickly, or D, encourage the resident to lie flat? I see A's, I see B's, I see C's. Ooh, we kind of have everything for this one. Yes, yes, yes. So you all, anytime somebody is at risk of aspiration because this person has difficulty swallowing, so that puts them at risk for aspiration or the food and fluid going into the lungs instead of esophagus down into the stomach. So anytime we are feeding somebody who has difficulty swallowing, the first thing you want to do is elevate the head of the bed. Now, because we know that thin fluids are probably going to go into the trachea, into the lungs, if this person has thickened liquids, you want to thicken them to the correct consistency. So the correct response is going to be B, but I want you to be aware that if this person hasn't been evaluated by the nurse, if they have not been evaluated by the speech therapist, you shouldn't be feeding them. This should be a nurse's responsibility. So we're going to assume this person has been assessed and that they have their thickened liquids in the room. So you're going to do B. The resident with difficulty swallowing may need thickened liquids to reduce the risk of aspiration, and their head should be elevated during the meals. Question 72 of our 75 questions. What should a CNA do if they observe a resident being verbally abused by a staff member? Do you want to A, ignore the incident and continue care, B, report the incident to the nurse or supervisor immediately, C, confront the staff member, or D, tell the resident to ignore the abuse? That's right, my mandatory reporters. We are going to be B. We're going to do B. Don't be afraid of retaliation. If you're at a facility and you feel like you're going to be retaliated against for protecting your patients, you're at the wrong company. So the correct response is going to be B. You're going to report the incident to the nurse or the supervisor immediately, because verbal abuse is a form of mistreatment that should be reported immediately to protect the resident and to ensure corrective action is taken. If you cannot participate on your team or with your team members without feeling retaliation or that you're going to be getting worse assignments, look, once you're a CNA, once you're a nurse, you're going to have so many opportunities. Pray about it and consider moving on, because if they are abusing the patients verbally, they're probably also going to escalate and start abusing the patient physically. And so you don't want to be a part of that. Question 73. A resident's religious beliefs prohibit the consumption of certain foods. How should the CNA handle this situation? Is it A, ignore the dietary restrictions, B, offer the restricted food anyway, C, respect the resident's belief and report the dietary needs to the nurse, D, convince the resident to eat the restricted food? Hmm. You all are too smart for that. You know what you're going to do. You're going to do C. You're going to respect the resident's belief and report the dietary needs to the nurse. And so the nurse can consult the dietitian, the dietary aide, to make sure that once the doctor has changed the diet in the system, to get a tray up to that patient faster, because we don't want them having a delay in eating because maybe they don't eat pork products and they sent up a breakfast tray with bacon. So they would have to remake this patient's entrees and bring them up. So if a person has a kosher diet or if they're a vegetarian, you want to honor those dietary restrictions. Question 774. The suffix itis in medical terminology indicates, is it A, a condition of swelling, B, inflammation, C, infection, or D, cutting into? I see C's, I see B's. Oh, I see just as many C's as I see B's. Oh, it is a tie. All right, you all. If you chose, actually, itis refers to inflammation. So the suffix itis refers to inflammation. For example, arthritis refers to inflammation of the joints. Understanding this suffix helps CNAs recognize conditions related to inflammation. But we know the inflammation is more than likely could be caused by an infection. So if you chose B or I think it was C, we're going to give you that one because I don't like how that question was worded. And then our last question, you all. 75. A CNA is assisting a resident with oral care who has dentures. If you do not have a denture brush, what is the proper way to clean the dentures? Is it A, use hot water and a hard brush? B, scrub the dentures with a toothbrush and toothpaste? C, soak the dentures in a denture solution and brush them with a soft brush? Or D, clean the dentures with a washcloth? All right, so not every medical facility or every rehabilitation facility is going to provide your patients with denture brushes. But what they might provide them with would be an effervescent tablet that you drop into the water, which makes a cleaning solution, your denture solution, and you would let the dentures soak overnight. And then whenever you remove the dentures in the morning, you would rinse them off and you would brush them with the regular toothbrush, since your facility did not provide a denture brush. And so for this one, the correct response will be C. So dentures should be soaked in a denture solution and cleaned with a soft brush to avoid damaging them and to maintain proper oral hygiene. So you all, I am so just absolutely proud of you. You should give yourself a round of applause, some thumbs up. And so if you enjoyed this video, please like the video, subscribe to our channel, consider giving us a super thanks. I think yesterday someone sent a super thanks for 29 cents. It doesn't matter. We appreciate you all because it all goes toward our coffee fund. And I'm going to stay around for a few moments to see what questions you all have. And then Shadi, whoever's saying thank you, Sheena, Quinice, Fatima, Miss Excellent, you all are very welcome. if you are impacted by Hurricane Helene, by Hurricane Milton, which we have coming over to Florida, of course, you all are in our prayers. Florida strong. We've survived many hurricanes. It's just going to be an inconvenience for a while. So thank you all for praying for us. But we are here to support you as you support us. And I feel like you are part of our family. So I love you all. I'm hanging around for about 2 minutes. Oh, Suffolk. Yep, you're living in Broward County. So you're insulated. And I'll be praying for you also. Thank you so much, Miss Vivian. So my exam is tomorrow. Can see how you did so great. So I know you're going to pass your test. You're welcome, Wilda. You're welcome, Novelette. So if you all don't have any questions, I haven't eaten yet. I got to go make a big old pot of spaghetti in case we lose power. We'll have food for a few days. And so I love you. God bless you. And Fatima, because of the storm, I don't know when the next class is going to be. So it may not be until Monday. But if we don't lose power for too long, I will come back over the weekend. All right. So bye, everybody. Good luck on your test. And just passed her test. I'm so proud of you. Which website do I use to register for Prometric? Depends on what state you're in. So go, I will Google Prometric CNA exam. And then they have different links based on what state. Yes, we have a skills playlist. I think someone just asked about that. If you're in Guyana, we can't have you do our CNA course because we can't provide certifications. If you're taking a test in the state of Florida, you would have to be a resident of the United States, and we don't provide any type of assistance which you get in your work visas, etc. And in Asata, if you live in Virginia, of course, these questions are good. Pretty much around the world. So it's just based off of current standards. And so we hope that you do well also. And let's see if there's anybody else who has questions. So can see if you're in Florida, I'm going to put it in the chat. It is prometric.com/nurse aid with an E on the end /FL. And that is how you're registered for your CNA examination in the state of Florida. It looks like Miramu is in Tennessee. Quinice is from Georgia. And all right, everybody, I love you all. Bye. See you in the next video.